we need to see trends in microbes, in toxins, trends that are sometimes invisible, that can be done through genomic epidemiology, that can be done looking at air pollution or water pollution. We have new problems that we're really just beginning to learn about, including microplastics, nanoparticles, endocrine disruptors. And one of the greats in public health history is a woman named Alice Hamilton. She really created the field of occupational health in the United States. She was also the first female professor at Harvard University. And she predicted, Cassandra-like, that we should not allow lead in gasoline because you wouldn't be able to control it. And we didn't listen. And because of that, generations of Americans grew up lead poisoned and less creative, productive, intelligent than they would have been otherwise. It was a tragedy of almost unimaginable proportions. So I think one of the things that we have to see is the trends in disease. Another thing we have to see is why we ignore warnings. And then we have to see the pathway to progress. And that can be pretty difficult to figure out. What works, what will work at scale, how to sift through the evidence. Often it's said that randomized controlled trials are the gold standard for evidence, and they are fantastic for certain things. They are not fantastic for many public health programs. And so the way to get most accurate information ranges by the question. And the Nobel laureates Angus Deaton and Case have discussed this as well. It's a real misconception that the randomized controlled trial is always the best study. Sometimes it absolutely is the best way to study, but not always. So we need to see the trends, the risks, the pathway to progress, what blocks us from going down that pathway, and whether or not we're succeeding or failing.